Dr. Lindsey, always great to catch up with you. And, just wanted to touch base and say, well done yet again. You have been on the Best Hair Transplant Surgeon in the World article, which is housed on ApetoGentleman. This is the 2023 edition. You've been on the article since it started, and for very good reason. I have worked with you directly, helping your patients ever since I had a hair transplant with you several years ago now. You are incredibly in touch with what the patient wants, and you don't tell the patient what they want to hear. You tell them what they need to hear, and you have a great bedside manner as well as delivering fantastic results time and time again. You're very consistent, and given all the tools in your box, especially with all your facial plastic surgery as well, like we know, you see a lot of repair patients, and it's great that doctors like you are out there to take care of patients in such an incredibly compassionate and an appropriate way. You don't, like I say, you don't tell them what they want to hear. And I just want to say well done, because the work that you do is incredible and incredibly consistent. And I'm proud to work with you, and I'm proud to house you on the Best Hair Transplant Surgeons in the World article yet again.
Well, thanks. It's a real honor to do 5 years in a row. And you're right, Specs. We've known each other a long time. You were over here. We were just talking about kids when Julia had her bone marrow transplant in 2011. That's the last time. That's when I worked on it, and that's 12 years ago. It's
Yeah,
crazy.
God, it's that long ago. Wow.
And I think you're exactly right. The field has never been more crowded with people who worship the almighty dollar or British pound or euro or whatever it is. And the number of reputable clinics is limited. And the poor victim or customer or client or patient really has a tough time in discerning who will do a reasonable job. And I'm really appreciative to the work that you do online and this article. It's awesome.
Yeah, great. And I know, like, it's interesting because you've been on it for so long. You've actually seen the real benefits of how this article has educated and protected so many patients that are out there researching or, looking into hair transplant, not necessarily researching, and have been very fortunate to stumble across this article because it's organic reach. It's had millions of views. And you've seen patients come in who've referred to the article, who have then realized, gosh, I didn't realize how much was involved with a hair transplant, and that there were, certain surgeons that dedicate their life to this craft and only do hair transplants and produce, incredible results for a reason, and that it's not a cookie cutter type of procedure. So tell us a little bit about, patients that have found the article, that have come to you, and essentially how fortunate you realize that they've been for finding the article.
So maybe there's three or four phases. So there was the before the article time frame, and that was, we were doing about 80% repair work. And then the article came out, and the percentage of repair work didn't really change, except the people that came in for virgin consultations or repair consultations were more informed. And instead of me being their third or fourth repair, I was their second repair. They had only gone one place before they found us. And then COVID happened. And then our repair work went to essentially zero, because people sat at home with nothing to do except look on the internet and find your article and maybe one or two forums and watch YouTube videos. And they became much more educated consumers. And our business shot way up. I think, unfortunately, we're finding that everybody's business shot way up as well, because we're now seeing the post-COVID now article, which is repair work is going dramatically up, and people saying that I wish I would have found this article before I saw, Dr. Schmo, so that they could have gotten the hairline that would age well, gotten the density that they wanted, or maybe found out that they were not a great candidate for a hair transplant.
Well, that's a really good point, because the article does stress, despite the fact it's got, and it is titled The Best Hair Transplant Surgeons in the World, it gathers a lot of attention, and there are a number of surgeons on it. The list of surgeons on the article is not exhaustive. There are many other surgeons out there that are fantastic, and I would trust my head with. However, the article is designed to give a range of doctors all over the world to help provide accurate ethical consultations with, to determine whether that patient actually is an eligible candidate, because the article states surgery is a last resort. And what I have found from surgeons that are on the list and the feedback that I've gained is patients that are coming in for consultations are informed patients. They're educated patients as a result of reading this article. And as far as I'm concerned, I've done my job if I can help educate a patient. So when he's sat in front of a hair transplant surgeon, he's got a few tools in his box and he's not completely and utterly green with regards to preying on every word the hair transplant surgeon says. Because if he's in the wrong hands, in the wrong hair transplant surgeon's suite, they can tell them what they want to hear and not what they need to hear. And I know for a fact, given the thousands of patients I've dealt with over the years that have consulted with you, you very much tell them what they need to hear. And that's why I'm very proud to house you and be associated with you, because I know you are a straight shooter. And not many are in this space, given the whole space that's out there. You know, as a percentage of doctors, a very small percentage of doctors that tell patients exactly how it is and have their best interest at heart as if they were a family member. Wouldn't you agree?
Definitely. I mean, I can think of two people last week, 24, 25-year-old kid. My kids are 23 and 25. So sometimes I come across to these young fellows and I try to get them to bring their parents in like a grumpy dad, but I want them to think through it. You could sell these poor kids that have low self-esteem anything. You could sell them this to sleep with, and that would make them their hair grow. And so you got to be careful that you don't oversell these children that really don't need much, or maybe they need a whole lot of hair and they need to think this through. Or the guy that's my age that's divorced and maybe getting to the end of his career and he just needs some oomph, and you could sell that guy anything. And so you have to treat people as if they're a neighbor. And because once you start operating on somebody, you've really bought that person for the foreseeable future. They can come talk to you about anything. They'll certainly find you if it didn't work out the way they wanted to, and if they felt like they were deceived, they can be quite irritated. And so it's much more inexpensive to do things correctly one time or two times if it's a two case, than three or four or five little teeny cases and whittle away and just take people's money and never really make somebody satisfied.
Yeah. And I mean, that's the bottom line. It's about being ethical, being honest, and looking out for that fellow hair transplant patient, because they are often very much in need, very desperate, very vulnerable. And it's doctors like you who make sure that they are protected and that they are put on the right track, whether that's medication or whether they're told that they're not deemed an eligible candidate, or a candidate, and therefore perform a very ethical, appropriate surgery on them that will age well. But listen, Doc.
Yeah, yeah, that's why I put up all those videos. I mean, we currently have now done our 4,000th hair transplant, and I've got 433 YouTube videos. It's not because I'm inherently photogenic. It's mainly so that people can see a representative spectrum of patients. In fact, one of my more recent videos is a marginal candidate. I mean, who puts up a marginal candidate results? But not everybody that rolls into a hair transplant office has got a lustrous mane of hair like you do, Specs. A lot of them have less hair, and so you gotta. Yet they still want something done, and so if you can show them what might be possible, rather than somebody like Fabio, then they
Mm.
can make an informed decision on whether this is reasonable, or maybe they should just not do anything at all.
No,
You know?
I know. It's a case of education and realistic expectations. But I do agree, Doc. I think you've definitely got a face for radio. But your YouTube videos are fantastic. And Doc, just while we're here, what is your YouTube channel name that you can refer to so people can find it?
There's a link on our website, and you just go on YouTube and search Dr. Lindsey hair transplant.
Fantastic. Well, listen, Doc, thank you so much for your time. Always a pleasure. And, just please keep up the great work and keep doing what you do, because, patients really do benefit and really do feedback into me personally of what a great experience they've had with you and how caring you are. And that for me is all I need to hear from any surgeon that I kind of associate with, and put on such a prolific article as the best hair transplant surgeons in the world. And it's important to have interviews like this to make patients understand why doctors like yourself are on such a list. So thanks so much for all your time, Doc.
Thank you, and come visit sometime.